Machakos County is one among other few counties in Kenya which have endorsed the Kenya Medical Care Policy 2020 to 2030, which seeks to establish a working emergency medical care. These are services that provide urgent pre-hospital treatment and stabilization for serious illness. The EMC, which is one of President Uhuru Kenyatta's plan on universal healthcare (UHC), was released last year by the national government through the Ministry of Health with the goal of reducing mortality rates in healthcare centers. Here's Mark Himondo with that report.
With accidents being part of our daily lives, a rise in morbidity and mortality rates has remained a matter of concern for decades in Kenya. The country has been experiencing an increasing number of mass casualty incidents ranging from collapse of buildings, flooding, road traffic accidents, among others. Due to lack of fast and convenient agencies, most of them end up losing their lives. It is with this reason that the national government through the Ministry of Health released the Kenya Medical Care Policy 2020-2030 in November last year, which seeks to establish a working emergency medical care as a key component of the healthcare system. Machakos County is one among other few counties in Kenya that have endorsed the system in a bid to reduce mortality rates. As explained by Emergency Medicine Kenya Foundation Executive Director Dr. Benjamin Washira, emergency medical service, also known as ambulance services, are emergency services that provide urgent pre-hospital treatment and stabilization for serious illness and injuries.
So the emergency care systems framework essentially looks at what happens when someone falls acutely ill or injured, and it starts with, first of all, the bystander response, where the community supports the person and who's having an emergency, and then they make a phone call to a designated dispatch center. So the phone call, the numbers should be short numbers. You know the way 999 works, and even now when Ministry of Health put in 719. So they make that phone call, and at the dispatch center, there are trained providers who then are able to understand what is the emergency, provide instructions for the person calling on what to do as they send the ambulance to your location. So the dispatch center allows them to see where you are, which is the nearest ambulance, and which is the nearest facility that is best to send you when you're, based on the emergency that you're having.
This is one of the dispatch centers in Machakos County, where people make calls seeking for emergency medical care services.
Metro Machakos, my name is John Mutunga. How can I help you?
This is a clinical officer trying to communicate with someone who claims to have been involved in an emergency.
If there is a road traffic accident, the public, they are aware of the numbers they are able to call, and when they call, the dispatch officers who sit in this room, they are able to know the nearest ambulance and the nearest health facility for that matter. So, for instance, if somebody says he has a road traffic accident, or he has been involved in a road traffic accident along Mombasa Road, we have a standby ambulance in the junction there, and the guys who sit here, they have the contacts of the ambulance crew at that place. So they will dispatch them, they will tell them, okay, there's a road traffic accident along Mombasa Road, near maybe Mto wa Mawe, Vista. They'll give a direction, and they give a contact number for the person who was calling. Then the guys, once they dispatch, they go, they take that casualties. Once they rescue the casualties, they bring them to Machakos level 5.
Now this is the CCTV control room, and one of the most important parts in this particular dispatch center, it's where the roads are of course monitored to give a view of what's happening outside there.
We have CCTV control rooms in all our sub-counties, and this is just one of them. This specifically for this control room, we house CCTV images from cameras located in Machakos town, Machakos Stadium, and from Chumbi to Machakos town. That is the highway. We do work closely with the security agents, that is mainly Kenya Police, the CID, when they need CCTV footage and there are investigations that are ongoing, we are able to provide images.
In this particular video, a lorry driver is seen reversing recklessly. In a few seconds, he knocks a pole, which falls and knocks a person. People are then seen converging at the scene of the accident, with the lorry disappearing unnoticed, leaving the victim nursing serious injuries. In a nick of time, an ambulance reaches at the scene and picks the victim. The incident shows how the system operates.
According to the statistics, like the most cases we receive like on daily basis, there are road traffic accidents, and then there are those mother in labor. Actually, ideally, when His Excellency the government was purchasing the 70 ambulances, his idea was that no mother should deliver maybe on the way or at home. So the most cases we get are this mother in labor. When you go to our medical data there, you find that we have really very much reduced the maternal deaths.
Machakos Health and Emergency Services CEC, Dr. Ansend Kitoku Nzioke, says over 600,000 people have benefited from the initiative that has seen mortality rates in the county decrease.
We can be able to save so many lives because by the time they call the police or they call the ambulance, there is a lot they can do and they have been trying to do down there. And again, we know that sometimes with good intentions, bad outcomes come. And therefore, when we train these motorcycle riders and of course the rest of the population, that the do's and the don'ts at an accident scene, that is a big, to make a huge difference.
The dispatch center works hand in hand with Machakos Emergency Department Center, which is one of the largest casualties centers in the county. After being ambulanced, a patient is then rushed in this emergency center where stabilization happens.
And then any other patients, adults, we've divided from pediatric, medical patients, surgical, and all the emergency care is done. This is blood transfusion. The first initiation of management is to get to know the complaints of the patients. Then we take the history, do the physical exam, then initiates. We have a resident medical officer here who reviews the patient and gives the way forward for the plan or the care.
We have seven ambulances that are basic life support and 5 ambulances that are advanced life support, and they are functional.
The center, built in 2014, has 8 oxygen points and a minor theater to offer quick surgery services to victims who might need instant surgery after the accidents occur. Avoiding an accident can sometimes be a challenge. However, the next step taken after an accident has unfolded determines a lot on the survival probability of the victims of a particular accident. Being one of President Uhuru Kenyatta's plan in the universal health coverage, the initiative is expected to reduce mortality rate not only in this particular county, but of course in the whole country at large. Mark Kimondo for Hope TV, Machakos County.